There are still a lot of questions about the coronavirus and what happens if somebody contracts it. How does it work? This morning, I'm joined by Dr. Connie Price. She is Chief Medical Officer at Denver Health Medical Center and an infectious disease specialist. It just happens to be the case that you were uniquely qualified for this job. First of all, some hospitals in some parts of the country right now are setting up tents to deal with people. Are you folks planning to do that?
Well, we are looking at setting up alternative care sites, mostly for the assessment of fever and respiratory illness in the large number of people seeking evaluation for those symptoms.
Don't know where to be yet, though, if and when, right?
Well, I think when we get the more access to testing, then we can offer those services.
Still a shortage of testing.
Still a shortage.
Okay. Hey, let's talk about what happens when we get COVID-19. As it enters our body, it comes in through the mouth, the nose, or the eyes, right? That's why we're told not to touch our faces. It goes to the back of your throat, and it latches on there. What does it do?
Well, in most people, 80% or so, it will just cause mild symptoms. It'll essentially stay there and produce cold-like symptoms, maybe a mild flu-like symptom. But then in some, it progresses down the respiratory tract and infects the lungs, and it can cause pneumonia. And even continuing on from that, it can progress to a syndrome called acute respiratory distress syndrome. And that makes the lungs fill up with fluid, and it makes it difficult to get oxygen to the tissues. And not only do you then need assistance with breathing, but then it shuts down your other organs as well. So people can get critically ill in a small percentage of these patients.
And that is the problem for a lot of hospital systems, is the number of respirators, because those people need assistance with breathing, right? And that has to be of concern to you right now.
Yeah.
I don't know if you have a number on the number of respirators you have, but do you feel you have enough?
Well, I think we're all going to have to work together as hospitals to share resources in this. We have a large number of respirators, including some that we keep in reserve for situations like this. But ultimately, if we see that we're being overwhelmed, similar to what is happening in Italy, we are going to have to share resources and steward those in the worst case scenario. So we don't want to have to get to that point.
This virus, it tracks along the mucous membranes, which means it gets into our lungs, where we have mucous membranes. We also have them in our digestive tracts as well.
Right.
So there also are people who could be sick in that way too, right?
Yeah, there are a small number of patients who will have nausea and some gastrointestinal symptoms, and there is some evidence that you can actually shed virus through the stool as well. So it's really important that we remember the hand hygiene.
And hand hygiene and all that hygiene. Do you necessarily have a fever if you have coronavirus?
Most of the patients who do get sick from this do present with fever eventually, but their initial symptoms may not be that, and they may actually be infectious to others even before their fever.
There's some reports in China of people who have done fairly well. They do okay, but then it, in a sense, comes back on them, and they grow worse. And I've heard, essentially horror stories about that. Explain.
Yeah, well, so some people will initially get the symptoms and seem to be doing okay, and then around day 7 of their illness, they will rapidly decline. And those are the people who are getting the pneumonia and progressing to the acute respiratory distress syndrome. And that's something that can happen. And so if you start having symptoms of shortness of breath and have trouble breathing and increased work of breathing or dehydration, be in tune to that and make sure you seek medical attention at that point.
I have to do it. Good luck. Connie Price, thank you very much. And as I say, good luck to you and all your staff at Denver Health Medical Center. We appreciate your time this morning.